Okay, so welcome back, everybody, for the new episode of the Crosse Thinkers. This is the second time we shoot it online. And today we have Dr. Peter Wilker joining us to talk about the coronavirus, which is the pandemic which is going on right now. Uh, Thank you for joining us, Peter, for the second time.
Sure, happy to do it.
Great. So let's start with the very basic question. So what is COVID-19, which is the coronavirus, and why is it so special?
Well, so COVID-19 is a new novel coronavirus that emerged late in 2019. And it's in a family of viruses that are collectively called coronaviruses. But this one's special because it's brand spanking new. And the reason it's becoming such a critical situation is really because it's spreading so rapidly. And it's a virus that's able to inflict a much higher level of illness and mortality, unfortunately, in some people. Coronaviruses aren't new. There's a number of coronaviruses that circulate in mammals and birds. And in fact, maybe 20 to 30% of all seasonal colds are caused by other coronaviruses. So the type of virus isn't particularly new, but this specific virus is new and very, very worrisome, just from the standpoint of the severity of the disease that it seems to have the ability to cause.
So it's more severe symptoms, but why we only see so many deaths, I would say, like mortality so far? Because if you think about the flu caused a lot of deaths, like 10,000, 20,000 per year. And this one, we basically are panicking and shut down school just because of several hundreds of deaths. So are we overreacting, or actually is there any underlying mechanics or reasons we're doing that?
We're absolutely not overreacting. If anything, we're still underreacting. And I'll explain why the analogy to flu is a false analogy here. First of all, we're dealing with a virus that's brand new. And at the level of a population, what that means is everyone is immunologically naive. We have no pre-existing immunity to this virus. That's very different than what we have for the flu, where many of us have had prior infections or have been vaccinated. And that level of pre-existing immunity in a population for flu makes flu a more manageable situation. It's still a nasty virus. So that's one thing that's quite different with the new coronavirus. The other thing that you have to keep in mind is when you view this pandemic, you have to view it as with the idea that we are in the very, very early stages of this. We are just getting started. And the case counts are still low, but you can see how they're climbing extremely rapidly in the United States and elsewhere in the world. In terms of death, well, it's going to take a couple weeks for people who are severely ill to actually die. And so we're registering an increased number of deaths now, but the full reality of that toll isn't going to be realized for weeks and probably months, simply because we're so much in the early phase of this. People haven't had enough time, unfortunately, to succumb to coronavirus disease.
So you mentioned that for flu, basically we have seen them before, and as year by year, maybe we have a new kind of flu, but basically it's just a modification based on what we had previously. So we still kind of adjust our immune systems to attack it. But we also had coronavirus before. Why is this one dramatically different, totally different? Because you mentioned there are 30%, right? Which is already coronavirus.
Yep, that's a great question. So yes, the COVID-19 virus is in the same family of viruses as some that cause the common cold. But in terms of their genetics and then what the actual virus would look like in terms of its physical build, this virus is very different. And so from an immunological standpoint, it's so different than the other coronaviruses that the exposure to other coronaviruses is not going to confer any protection against this particular COVID-19 virus.
I see. So thinking about where these virus come from and thinking about maybe this virus is going to mutate in the future, does it look like this thing just naturally evolved from the old coronavirus just through natural selection? Or is it from mammals or animals or whatever?
Sure.
What are the possible causes? Yeah.
Well, I think the best evidence we have today, which is, everything that we know today is incomplete. But if you look at the genomic makeup of COVID-19, it appears to be most closely related to previously identified viruses in bats. So it is most likely that this virus crossed a species barrier, perhaps from bats, maybe through another intermediate animal, we don't know, but probably came from an animal reservoir and just happens to be one of the viruses that once it got into people was pretty well equipped to spread between people very efficiently. And sadly, also with a really high level of morbidity and mortality. So it's a rare event, but we kind of have a virus here that was created out of a perfect storm in terms of its biological characteristics. And it's going to be a really difficult one to get control over.
So how does this coronavirus spread, or how does people get infected?
Oh, there's a couple of different ways that we believe people can be infected. It's a respiratory pathogen, so then, as you might expect, if an infected person is coughing or sneezing, they can cough and sneeze those COVID viral particles in aerosolized droplets that other people breathe in to establish the next round of infection. It's also possible that ill individuals might, in terms of touching their face or eyes, might get some virus on their hands and then touch other inanimate objects and deposit the virus on those inanimate objects. And then if someone comes by at a later time point and touches that and then has their hands going to their mouth, to their eyes, to their nose, to their ears, that might be another way to have the virus be transmitted person to person.
So that's partly probably the reason we're recommended to wear gloves and cover our sniff with elbows, and also just basically try to clean everything. How long can the virus survive? Let's say I touch a door handle, right? It's not like I'm going to clean that thing again and again. So if I wait for 3 hours, 4 hours, or a day, how long does the virus can survive when it's not in the human body?
Sure. I think as a general rule for this type of virus, if you're 48 to 72 hours is probably how long it could persist on a surface. There's a lot of variables that would play into that. So the COVID-19 virus is a type of virus where it has its genome and some of the viral proteins surrounded by something called a lipid envelope, basically fat molecules. And those type of viruses aren't very hardy. They don't last or persist all that long. And so as soon as those viruses get deposited on some type of a surface, some of the viruses lose their infectivity. And it might take 24, 48, 72 hours for all of those viruses to lose their infectivity, but certainly it decays over time. So I do think this is the biggest reason we suggest hand washing very, very, very routinely. Because while you can't go out into the world, you can't go grocery shopping without touching surfaces that have perhaps been contaminated by an infected individuals. So people need to remember that and be very vigilant in using their hand sanitizer and soap and water. Soap and water is incredibly effective at inactivating these types of viruses. So yeah, in my house, we are washing our hands all the time. Every time we come into the house, we use sanitizer, and then we go right to the sink and we wash our hands, and we're all doing a pretty good job of reminding one another to do that. And we're developing some new patterns and behavior as a result of this. It's even starting to become second nature to us now. And I think everyone needs to do that. It's really important at this point.
That's great. Your family have a profession to basically direct their behaviors, right? That's great.
Yep.
Yeah. So if we stay away from our mouth and basically our face, can we roughly say at least, even we may carry the virus on our hand and other part, and we're pretty safe as long as we stay away from face?
Yeah, and social distancing is the other key component to this. Stay away from people as much as you can. You know, Tony Evers has the safer at home mandate now, where you really need to stay at home. If you must go out, and obviously there are times where people have to go out, everyone is going to need to replenish supplies at home. You just need to be aware of your physical environment and make an effort to keep that at least 6 feet of distance between you and other people. And so, yeah, continuous, rigorous hand washing and social distancing is how you can protect yourself. And by protecting yourself, protect the community at large as well. So everyone really does have a role to play here. And it's really important, and it's not an overreaction at all. And you don't have to look far in the news to find evidence of countries that are simply 2 weeks ahead of us in this. And I'm thinking of Italy in particular. You have a massive overwhelming of their healthcare system. And that's what we're trying to avoid here. Because if so many people get sick in one rapid wave, the healthcare system is going to be overwhelmed. You're simply not going to have facilities to treat all the seriously and critically ill people. And that's going to be a terrible situation to deal with. And I think that's what Governor Cuomo in New York is starting to think about very seriously. Because that is a situation that's very rapidly getting out of control. You know, and you can think about hospitals. There's a limited number of hospital beds. And there's an even more limited number of hospital beds that would be classified as intensive care unit beds, with the type of instrumentation that people with severe infection of this require. And once those beds are filled, once that equipment is being used for somebody, the next person in line maybe won't have access. And that type of supportive care is really important and necessary to keep people from dying from this. Okay. I should mention at this point, just to remind people, that it's about 20% of people who get infected appear to require some type of hospital level care. 80% of people who become infected either are asymptomatic, they have no signs or symptoms whatsoever, up to a mild to moderate infection. So the majority of people won't require that care, but as the case counts go up, we're going to experience such high numbers of cases that even 20% of those infected who are going to need care might not be able to receive it. It's also important in terms of protecting our healthcare workers. It's a big problem in other countries that have had this problem going on a little bit in advance of the United States, but healthcare workers get sick from this too. And well, you need physicians, you need nurses, you need respiratory therapists to provide that care. And if they all go down in a wave, that's just going to confound this problem of the overwhelmed healthcare system in this country. So that is why we're reacting so strongly in many states, not all states, across the country. It's to avoid that type of a situation where the medical infrastructure starts to break down.
That makes sense. So according to what I see online, I don't know if it's true or not, is older people more vulnerable to this virus? Like all the 20% people you're talking about, are they having severe symptoms because of this virus, or actually they're just having some other disease triggered by this virus?
Okay, well, so first of all, everyone's at risk. So no one should feel real confident about their own personal outcome if they are to be infected. It's something that we all individually, regardless of your age or your medical history, you really have to take this seriously. That said, absolutely, we see mortality rates climb with climbing age. So the older you are, the less good the outcome is in general. Beyond that, people with other types of health conditions, heart disease, diabetes, probably people who are smokers, they all also seem to fare much less well. Maybe the good news in all of this is young children seem to be largely spared. So we don't see a lot of deaths and not that many severe infections in the very, very young. But they can still spread it to other people who may have a much higher likelihood of a poor outcome.
So even for the people who didn't have symptoms and they're not bothered by this coronavirus, they still need to stay at home just not to pass this virus on other people who are vulnerable, right?
Yeah.
Even though you're cured.
Absolutely.
Makes sense.
If you are, everyone's susceptible. Everyone has to do their part. And you're doing it to protect yourself and you're doing it to protect others in the community. And that is fundamentally the only way that this is going to be brought under control. And we need to do it now because time is a wasting. As we get more cases, it's going to be much harder to contain it. And so I am very happy to see what Governor Evers is doing in the state of Wisconsin. He's moving pretty swiftly and strongly. And I'm a big supporter of the actions he's been taking. None of it's convenient. It's all terrible. I know people are out of work. That raises a ton of issues with financial hardship, childcare, and it's no fun. It is emotionally very difficult to basically home quarantine yourselves for an extended period of time. But it's necessary, and we'll settle into a new normal here as we go. And even over the last couple of weeks, you get into a little bit more of a rhythm of it. But yeah, it's all extremely challenging.
Thank you for saying that. I had some students before who were naive and saying, hey, I'm young. If I got coronavirus, I got coronavirus. I can survive it. But if you still have this kind of mindset, please take it seriously. And for the sake, not for yourself, but also for the people who are at your family. You got elders at your family, and for the people who got in touch and they have family too, and they have elders in their family. So if you could, do this for everybody and we're in this together.
It's the socially responsible and necessary thing to do, 100%.
Yeah. So let's talk about the pandemics. We have taken a lot of actions, no matter it's late or early. We're actually taking it very, very seriously starting from now. So what are the standard process of handling pandemics like this? Are there any standard procedures like process we should be waiting for? Are there any silver linings we should be watching for?
Yeah, there's not a universal playbook for this. In general, the way epidemiologists would try to contain something like this is by finding the cases and then tracing the context of the case to get the case into isolation and get the contacts into quarantine to really restrict where a virus is spreading. That's made awfully difficult here because of the restrictions and the limits of testing capability throughout the country. We simply do not have the capacity to do widespread coronavirus testing still today. It's been getting progressively better, but nowhere near where it should have been. And what makes me a little frustrated about the situation is we really did have a 2-month head start on this. And we didn't do a lot of the things at the federal level that should have been done in anticipation of the problem we're currently in. And testing is one of those things. So that leaves us with these approaches: social distancing, hand washing, school closures, business closures, restaurant and bar closures, really putting a lockdown on a lot of our normal social behaviors. That's really, at the moment, our only tool. And the idea is to slow this thing down, to slow the rate with which we have new cases, slow it to such a level that those people who are ill still have the ability to receive care. And it might draw it out for a longer period of time, because the virus is not going to disappear anytime soon. But if we can slow the rate of new infections, we're going to save lives. And that's I think, what most people would like to see done. Of course, you can't go on like that forever. And I wish I could tell you how long this was going to take. But I think we reasonably need to think about this continuing on the order of months. It's not weeks. We won't even know the trajectory of this for probably another couple of weeks. And, you know, it's a regional problem too. So the story in New York is different than the story in Seattle, is different than the story in Madison, is different than the story in La Crosse. So you really have to pay attention to what's going on in different regions to track what's going on and look at the success of some of these public health interventions that are being put into place. But it's going to be a long haul. And I think you're starting to appreciate that from some of the discussions that are taking place, for example, with the press conferences that the president puts on daily. And there's no easy answers to any of it. And different people are clearly advocating different positions in terms of, well, we need to open up businesses and get back to the work of economic recovery. And from a public health perspective, I think most people, probably the overwhelming majority of people, would say it's way too early to start having that conversation yet. And that's definitely where I fall. It's too early to have that conversation about opening things up again. But I don't know how long it's going to take. I see it going through summer or into summer, unfortunately.
There are some things I read online, like maybe the virus will just disappear as things get warmer, the temperature get warmer. Is that possible?
I don't think it's going to disappear. So for many respiratory pathogens, there is a seasonal pattern, right? So you think about the seasonal flu. We have a flu season, we have a cold season. It starts in the Northern Hemisphere in fall and continues through March or April. And coronaviruses oftentimes do have a seasonal pattern. But I think we have so many cases of this, though transmission may slow down as we get to the summer months, I don't think it's going to stop. And there's no guarantee that this virus has a seasonal pattern at all. We're just keeping our fingers crossed on that. And there's reasons to have some hope that that will help. But there are a number of countries with a very significant problem that are not in a winter season right now. And they're in the tropics and have had just as bad a problem with COVID-19 as we're experiencing in the United States. So for those reasons, I don't think that the coming summer months are going to take care of it. You know, Australia's in the summer right now. They have community spread. So I don't think it's going away.
Okay, let's hope for that, but we cannot bet on that. So because as a normal family, we have financial situations and everything, so we understand this is the new norm now. Maybe we'll last month. We're not there yet, but what will make you think, wow, we got this? If you see this happening, or you see this number, you see the V curve turning, or maybe you see the vaccine comes out, that's the moment we say, okay, finally it's over.
In the short term, what I'd like to see is when you look at these case count graphs, right now we're experiencing exponential growth, okay? And the data is incomplete, the data is not that good, we don't really test very much, But even with the testing that's currently being done, those case counts in the United States are going through the roof. I'll start to feel better when we get out of an exponential phase of growth in the number of cases that we experience. When it goes up and then starts to level off a little bit, that'll be a good indicator that it's at least slowing down. And you necessarily have to get there. If everyone in the country gets infected, well, then no one's susceptible anymore and it'll quiet itself out. I'd rather that's not how this got under control. Yeah. I'm hoping that our interventions help get us there a little bit more quickly. And that's going to take some time. And in that time, what I'm also very hopeful of is that they can get a vaccine into clinical trials rapidly and get it mass produced. Because a vaccine is really what is going to, or would be able to give us really tremendous public health control over this. Because without a vaccine and without any type of an antiviral prophylactic, which we don't have for this, you're really left with these public health measures that are extremely economically damaging and massively inconvenient to the populace.
How difficult or how long does it take to develop a vaccine, hypothetically?
Well, you hear some very different suggestions on that front. You need to develop a vaccine, just conceptually, how do you want to produce it? You need to send it through some clinical trials, phase 1, phase 2, phase 3, because you absolutely need to make sure it's safe. We don't want to cause more harm to people through a vaccine than the good we're accomplishing. And you need to scientifically show that. That's very important. Hopefully we can accelerate that process. And then you need to find a manufacturer to mass produce it so that you can administer just this country alone, 300 million doses. And that all takes time. And I think we're definitely here talking on the order of maybe 5-6 months on the short end of it. In 2009, we had the swine flu pandemic, and they went through manufacturing of a vaccine as quickly as they possibly could, and it still took 6 months. That was about as good as they could do. And nothing's really changed from 2009 to today on that front. We still need to do the testing, the safety testing, the efficacy testing, and then we got to make it and ship it and deliver it and administer it. And so that's down the road. Boy, when that day comes, that'll be the game changer for us. So I'm very hopeful. Again, no guarantees in the world, but for this particular virus, I'm at least hopeful that there will be an effective vaccine down the road.
Is it a matter of resource or is it a matter of luck?
Probably a little bit of both. There's no guarantees that a vaccine is going to confer the level of protective immunity in a population that you would like. I think we can get there on this particular virus, but there are other viruses where we have not been able to make an effective vaccine. And oftentimes it has to do with the particular biology of the viruses. So dengue virus or HIV, we don't have vaccines for those, even though we sure would like one. But for this particular virus, I think it's doable. But it's just the fact that you really fundamentally have to test this and make sure it's safe before you give it to billions of people across the world. You don't want to cause more deaths from a vaccine than the actual virus you're trying to protect from. And then just producing that mass quantity of vaccines, and it just is going to take some time.
And it better be an international collaboration, just like one country or several countries fighting alone.
Yeah, I would hope that there's a number of groups with kind of pre-built infrastructure for vaccine production getting called in for this.
what about the treatment? Let's say vaccine is preventing people from getting it, but what about the people who are getting it? Can we treat them right now? Can we kill the virus in your body right now?
So in terms of treatment, it's really supportive care. So if people are having difficulty breathing, we help them along. And really, again, we are just trying to keep people alive long enough that their immune system does the work of attacking the virus and clearing it from a person's body. There's been a lot of talk about perhaps some pharmaceuticals that could help lessen the severity of infection. And again, all of those reports are anecdotal, and those drugs may help, or they may not, or they may make it worse. And before I think we get too excited about that, there has to be a more rigorous clinical study, controlled clinical study, to look at if those drugs actually are providing a benefit to people who are infected. You really have to follow the science. You can't just go on your gut. And yeah, I'm hopeful. There's really good anecdotal evidence that some of these drugs may be helpful. And now people will do the quick and necessary work of rigorously testing that in people to show whether it works or doesn't. And then we go from there.
Will the development of those kind of drugs faster than vaccine?
The drugs that I'm thinking of have existed for a long time.
Okay.
And they've been used for a long time. They have good safety profiles. We know a lot about them. We just don't know a lot about them in this context of COVID-19 infection. I would suspect that production of those types of drugs could be ramped up very quickly, because it's more to do with chemistry than biology.
So what we're waiting for is just make sure the test is working, it's tested scientifically, and then we can just mass production really quickly and try to use it to treat people.
Yeah, and yes, and it's not going to be a cure-all, right? I think the situation that we're trying to avoid is having information get out there, and then having people all across the country getting their hands on these drugs that just simply haven't been shown to be effective in this, and taking them off label. I read this morning about someone who took one of these drugs and actually overdosed and died from that off-label use. So yeah, they have a good safety profile, but every drug, every medical intervention does have side effects, and we need to weigh and balance the good versus the bad on these things. And the way to do that is with evidence, with science.
Probably also depends on how desperate we are, but let's hope we don't have to go to that route.
Yeah, well, and these drugs are used by other people for very important purposes. And so there's a lot of discussion if we start using these particular drugs off-label without evidence for COVID-19, that people who have been taking these drugs for their other medical conditions for years may no longer be able to get that drug, and they for sure will suffer as a result. So I think we just need to make sure first. Yeah.
Okay, so we've talked about the virus in general and how do we handle the pandemics and everything in general. What about La Crosse? What about locally? Like, how do you think La Crosse is doing?
Well, I think we live in a special community of people who are generally very willing to do their part. Again, it's I would imagine it's in our community. I would imagine we have some level of community spread. It's very difficult to assess because we're simply not doing a lot of testing of individuals. If you showed up to the hospital and had fever and a dry cough, you wouldn't be tested unless you were so severely sick that you needed to be hospitalized. So just having a fever and a cough right now is not sufficient to be tested locally. And that might change. It might change tomorrow. It might not. But the fact that we haven't counted that many cases, I think, is potentially a little misleading because we're not testing. And people need to remember that. I think we're in a much better situation than a lot of other places right now. And I think it's our job to keep it that way. And so I've been pretty proud of people in the Crosse. They're doing their thing. You know, if businesses are doing their part. You know, a lot of businesses had to get some stuff from Target. They have curbside pickup, so you can place your orders online. They'll run it out to your car. You don't have to interact with anyone. You don't have to shop in the aisles at Target. And there's a lot of businesses doing the same kind of thing. And restaurants, you can get carryout. And I think it'd be great if we supported the local restaurants. So places are really going to have a difficult time with this. So if, you know, you have a hankering for something to eat, go get some carryout from one of your favorite places. Help them pay the bills to get through this a little bit.
So when you get
it's
food from a local restaurant, like you wash your hands and basically you're okay, right?
Yeah, I would unpack the food and get rid of the bag that was handled by people and wash my hands before I was eating. And, you know, you can't eliminate risk. The way to eliminate risk is, man, just sit in your home and never leave. But, you know, I'm going to go for a walk. I'm going to interact with my kids. I'm going to have to, at some point, get food from the grocery store. And I am not going to contribute to the problem of, by hoarding food and toilet paper. I think that's unproductive and not helpful. And so, yeah, I'll just limit my risk, limit potential for exposure as best I can, while still having some semblance of a life. And that's a difficult balance, a difficult line to walk, but it can be done. And I think for me, ordering carryout once in a while from a local business, it's a way to get something I really enjoy and support people in your community who are really struggling from a business perspective.
Is there anything, let's just talk about locally, anything as an individual or community we can do and we haven't done yet, which you think may be helpful or essential?
Well, I think it comes all back to the most important message, which is people need to do their part. People need to stay home as much as possible. People need to social distance. You know, my kids are not having play dates. We're not allowing them into other people's houses, and they're not allowing other people into our house. It stinks, but it's necessary. And if everyone does their part and everyone takes this seriously, this will be over much more quickly with a lot less disruption than if we don't do those things. And so it really comes down to these simple public health interventions and personal behaviors. And if we do them collectively, we'll be in much better shape than if we don't.
Thanks for saying that. Yeah, that's really important. It's a hard time for everybody. Nobody likes this, but we need to get through this together. So for people who already develop some symptoms, which they don't know if it's caused by coronavirus or not, like dry cough, like a fever or anything, if we really get it, let's say, will that thing just eventually develop into a very severe one? Or actually it's possible that if you had a fever for, let's say 4 days, 5 days, and after that the fever is gone, or the dry cough, you just have a constant level, it never gets worse? Would that be okay to say, like, yeah, then probably you will survive this, even if you get it?
Well, first of all, if you have signs and symptoms that are consistent with a coronavirus infection, COVID-19 infection, so fever, a dry, non-productive cough, you're not coughing things up, you should call your medical provider. Which should be the first thing you do. I don't think you should go to an urgent care clinic or the ER. You should call the medical provider. And the hospitals have COVID lines set up now specifically to deal with those types of phone calls, and they'll provide you with instruction. As we were talking about before, the range of illness severity on this runs the gamut. From asymptomatic, you won't even know that you had the infection, all the way up to severe and critical infections and death. And so most people fall on the mild side of the equation, but enough of them develop into severe infections that it's, it's scary. It scares me. I know that. Yeah, I mean, every time I cough or I sneeze, you just have this thought in the back of your head, and it's scary stuff. And I have a reasonable understanding of what's going on, and it's still extremely scary. But in terms of interpreting your signs and symptoms to know what's coming downstream for you individually, I don't know. I would just for sure follow up with your medical provider by phone. Yeah.
Makes sense. Okay. I think that's all the questions I have today. And thank you so much for joining us and for doing this for this community. Do you have anything you want to say to your students?
No,
all our students.
Boy, I miss them. I already miss them. I'm going to miss them more every day as we go. Yeah, I teach because I enjoy the relationships I develop with my students, and that got a lot harder to maintain. We'll do the best we can, and we care about them, and I hope they're being safe. I hope you listen to what smart people say, and it matters, and I very much hope we get to see you back on campus in September.
Great. Thank you so much. Thank you, Peter.
All right. No problem.